know him. His profile is in the abstract book. So I would, with the best interest of time, quickly get our technical team to move into the webinar, where he's going to talk about the most recent area that he's involved in, the importance of nurses in ensuring privacy and security in digital health platforms. Professor Tony, can you hear us?
Nishan, can you guys hear me?
Yes, Professor Tony, we can hear you.
Yeah, I can hear you. Can you hear me?
Yes, we can.
All right, let me increase the volume. All right, so thanks for inviting me. Now, before I start, let me warn the audience, in case we have technological glitches, we normally have this. We will go into the audio, right? Let me share my screen. Can Nishan, you see my screen? Okay, hold on, I'll start again. Is better now?
Yeah.
Okay, so can I go through my screen rather than the local one?
Yeah, you can.
Okay, thank you. All right, good morning back to Sri Lankans. Now it is almost 4:30 in Brisbane. So my topic is somewhat challenging. Well, see how we can go. It is very interesting to see how nurses are going to play critical roles in the privacy conundrum. So the topic is importance of nurses in assuring privacy and security in digital health platform. I have a bit of an agenda, which is, the agenda is just to give you the background of the talk, which I did very briefly. Then we will go to the digital health platform. Well, you hear before me, there are so many talk about the digital space. I'll touch that one briefly. Then we will see what is the world trend. Then briefly about the health information system. Sometimes this may be mixed up with hospital information system. Pretty much the same. Then I'll walk you through about the privacy and security issues. Then we will see how we sustain our digital space through the trust and responsibility. Okay, now digital platform. We are talking about what is happening around us. Before that, we need to know what was still happening without digital space, paper-based. As you can see from your screen, if we are in the pre-electronic era, well, those who are familiar with databases, I will use the term database. The problem with storing patient records manually, well, those who are familiar with hospital recording room or record rooms, the problem is only one person can access the data at a given time, at the same time. And the records going missing. Handwritten notes are messy and hard to understand. The storage problem is huge. Now, some of the USB you might have can store 100 of hospitals' records, which is not going to take that much space. So this is the challenge. The top of this, I am comfortable to add another variable here. It is going to be controversial, but I will give you evidence, which paper-based records are not secure as long as privacy is concerned. We'll discuss that one as we go. So the digital health platform is a complex, information-intensive socio-technical system, which is, as we hear already, patient records are now stored electronically. Data can be accessed by more than one medics or professionals. No need to transport files, as you know. The biggest challenge is privacy and security. That also not a really complex. It is a complicated. We have to see how we can solve that. Latest information can be accessed from patient's bedside, which is Kitsiri mentioned before, and a previous speaker mentioned in South Australia how advanced they are. Now, as I mentioned, databases and health information systems, probably I'll leave it for you to read through. I hope that my screen is clear enough, how the medical databases is going to be sharing information, how accurate it should be, how the data be used for assessment, etc., etc. Coming back to a hypothetical system, which is, of course, this is available already. You can start from walking from your bottom left up to zigzag way. Doesn't matter which way you walk, you can see the interconnection, the system layer, the database layer, and the user layer, which most of you have familiar with this user layer. Now, two acronyms there. As usual in IT, we don't have any issue with acronyms. This HAI stand for Healthcare Oriented Infectious Management Subsystem. HL7 stand for Health Level Standard, HL77. SOA stand for Software Oriented Architecture. The rest is pretty straightforward, you can read through. This is just a hypothetical system, doesn't mean this is not going to exist. Most of the places this system is exist. Now, that is just a very brief of a digital platform as far as health records is concerned. Now, what is happening around us? What you can see here in this top left screen, by 2020, you will see the internet and the artificial intelligence, where you use the Google for search functions, will take over. Without these functions, ordering a pizza or buying a soap from your supermarket is going to be difficult. So you will use that. That is how the technology is maturing by the time. The rest is not necessary if you want to. This is database, desktop, operating system, internet, and AI I just mentioned to you. Is it really true? Of course it is true. What is happening in other part of the world? This is the data I got from US up to 2010. What you can see here is people using the internet for health purposes in each employment status. You can see very clearly how it is growing. What is happening with age category? You can notice this, less than 30 years old group is taking over. What is happening with the gender? Nothing changed. Well, of course, female is up all the time. Does it mean nurses are all the way going to go up and use the internet? Well, not quite there yet. We'll see how it's going to happen. It is happening. By 2020, this graph will have a different shape. It will be definitely improved that way, and that way. All right, health information systems. Health information system, basically, you already exposed to. However, you need to know why we need these. Other than going through these, all the text, busy slides, just to quickly, the requirements of health information systems are operational requirements. We are talking about information. Planning requirements, documentation, including your legal documentation. Functional requirements are the core system, patient scheduling, admission, discharge, transfer. And business and financial system, payroll, account receivable. The question mark is, depend on the country. They may have their different payroll system or reporting system. Similarly, the communication and networking system. Again, integration of all parts of the HIS, order entry and results and reporting. Question mark is country-specific functional requirements. Further, departmental management system, medical documentation system, medical support system. Repeating again, the question mark is country specific. This is what the world digital health system look like. For different part of the world, different part of the world, even different hospital may be different. Different silos, breeding, there's no point stopping it. We need to see how we can use those silos to make an informed critical decision. That is just about health information system. The important part is using the health information to make a clinical decision, you have to share it. When you are sharing the information, you must share between professionals, between patient, in between patient and professional, maybe next of kin. How do we do this? Electronically or paper copy? Electronically, you must have a consent. How do you do this? Well, who owns what? That is where the question. Let's start the privacy. Well, don't get mixed up. Privacy is not security. Privacy is a culturally dependent variable. It's a personal information, very personal. There is no substitute variable for that. It is not going to be replaced. It is irreplaceable. It's a high costly, emotionally, socially, psycho-socio-economically. If you lost your privacy, you can't replace what your currency. That is the difficult currency. So personally control, it is not really complex. It is a complicated scenario. So I'll leave it this slide you to quickly glance through. This definition is almost 50 years now, hasn't been changed. In a simple layman language, as an information technology point of view, if you lost the control of your information as long as it is pertaining to your privacy, what is going to happen is you lost your privacy. That is where we are at. And more on assurance and the privacy, I'll leave it this for you to quickly glance through. Those who are interested, this slide is available through the organizers, including one of the key paper I will be sharing with you. So there are competing concerns between the patient and the healthcare providers. There was a talk before me, I can't remember which talk. There was a question probably, I think Kitsiri mentioned, empowerment, empowering the patient to make their own decision, which is a good thing to reduce the cost of the healthcare. How we can do it? The best way to do it, we balance this competing concern. Security is rather different. It's not privacy. Security is to protect the breach of information used by unauthorized individual. That is where the thing's going to be very difficult to manage. That is where the complication is going to happen. So protecting and controlling the excess, we have to do this. This is where all the competing science and mathematics get involved, helping to manage the risk, which is the privacy, helping to solve the complicated variables, which is we discussed as a privacy, helping to negotiate the level of complexity, helping to manage the cost, where I told you already, social, psycho-economical cost. We have to educate people how to share the information. It is a personally control, how to share the information digitally. Again, digital records are safer than paper-based record. Well, we will discuss that one at the end. Now, the scenario is human versus machine. Rather than going through this matrix, the difficult part we have to tackle is when the human get involved in the decision-making loop. The rest is manageable. So that is the matrix. Rather than going to the maths, leave it that one that way. But remember, this is where the struggle we are having when we come to the information privacy management or security protocol issues. So the protocol we are using here is when you are unfamiliar scenario, what you will do. When you are in the familiar scenario, what you will be doing. Incidents, accident, threats, and transgressions. What does transgression means? Copying, plagiarizing, stealing, or borrowing. I'm talking about electronic health record here. How do we handle that? Complex versus complicated scenarios. Again, where do we put human, in particular nurses? Where do they make a decision? How they make a decision? Do they have enough evidence to make a decision? Have they been trained? These are all part and parcels of these complicated scenarios which must be evaluated from point 1 to point 6 sequentially and chronologically. If you are thinking about health information, this is one of the PhD completed by a Sri Lankan student proudly. And he came up with idea where this is the information flow, where the information is flowing, how do we manage that with accountability protocol. This is where the protocol we start up putting it. So the scenario is who owns what, where the information starting, just leaving you to read through different doctors, one patient, the electronic health record, how to manage the policies, etc., etc. So other than going to the too much detailed technical stuff, I'll skip that. This is where the policy comes in. Who, patient, and the health professionals, the authorities, finally we all share the information through our policy harmonization. If you are thinking about the electronic health record we are talking, who create the clinical record called electronic medical record, and who create your personal record, which is you as a patient, finally become electronic health record. What we are proposing is to go through all these to make sure the privacy is protected. This is the education issue. So again, this is the principle, this principle about how to protect the privacy and the legislative foundation. Probably this will leave it for the lawyers to handle. That may be another day talk. Finally, how do we measure this? To measure this one, you need to see who access what, at what time you access it, and how you access it, whether you are going to tell the truth, you access it or not, still debatable and hard to answer. This is not possible in paper-based, because paper-based, you don't know who accessing what. That is where the trouble. Now, the good part of this is where do we see nurses going to adhere to the trust and responsibilities. Trust and responsibilities are very difficult to manage and adhere to because we are talking about human here. So if we are going to be sustained digital space, digital health space, we must make sure we establish this trust and share the responsibility. How we can do this? Any health information system, digital recording system, digital ecosystem should follow these 10 principles. If these 10 principles are not properly balanced and followed, I don't imagine any digital health system going to be succeed. So you have seen lots and lots of countries are going through digital ecosystem. Some of them are not successful, which is classically one or two of them not follow these 10 golden rules, which is very important. Let's say if you really want to put health information system with information technology, you need to have these pillars: organizational accountability and ethics, people accepting controversial technology, information accountability framework. This is going to give you a classic idea of how that digital ecosystem going to be succeed. This is the Australian system. You can read the literature, how successful and how good we are, how bad we are, rather than I'm discussing. You are more than welcome to go and have a look. You can go to the Google and have a look this. You will find out this is almost $1.6 billion worth of project. Finally, nurses are everywhere. nurses are here part of this trust, part of the responsibility, training, robust project management, commitment to standard, which is training, how they adhere to the privacy and confidentiality, acknowledging the patient. The green color text are all nurses get involved to adhere to these two responsibilities. The challenge is what you will do if you end up in your hospital or somewhere in the public, which this person's health record is complete. What you will do for this? This scenario is very complicated. Those who are interested, these are the publication available. You can download. And this is the publication I mentioned, which you can borrow from the organizers. You must read. This is the publication came 20 years ago, saying very clearly electronic health record is safer. From that note, I am happy to stop and pass it to you, Nishan. Am I over the time?
Like as a session, we are over the time, Professor. So thank you very much for your detailed and wonderful presentation. Unfortunately, I don't think we can afford to go for a direct Q&A at the moment. We would make the context of all the speakers available to the audience and to the in the conference proceedings, so that any burning questions can be passed over. Thank you very much, Professor Tony. And
thank you.
And moving on, for this symposium, we had a presenter from